Welcome, MTA drivers. My name is Dr. Frank Meza. I'm from Kaiser Permanente, and I'm an assistant medical director at Los Angeles Medical Centers and the West Los Angeles Medical Centers. Today I've been asked to kind of talk to you about something that's a big concern to me and a big concern to Kaiser, and probably should be a concern to the whole country right now, and that's the issue of diabetes. We have a major epidemic as we speak today, and I think it's affecting you directly as the MTA drivers. We're going to discuss today some of the risk factors. We're going to discuss some of the reasons that this epidemic is taking place, and hopefully I can give you some ideas on some prevention. There's some things that we need to talk about because your family and all of your employees and co-workers can be affected by this. So we're going to talk about diabetes prevention. First of all, what's important is to know your family history, to make sure that you're visiting your doctor at the appropriate times and that you're being screened. We need to discuss some other issues, and that's really what's driving this epidemic. And a lot of times we wait till the symptoms occur, and I can tell you right now what the extreme symptoms of diabetes are. For example, extreme thirst, urination, this constant fatigue, you start to lose your vision, you become blurred, you start just feeling sick. But first, I think we have to start talking about how severe this epidemic is that's affecting the United States. Right now, we have about 18 million people in the United States that have already been diagnosed with diabetes, and we have millions of others, probably about 6 million, that we haven't even diagnosed yet or underdiagnosed. What is driving all of this? Well, we're now seeing that today we've increased our obesity rate. And if there's a take-home lesson from what we're about to discuss, is that it's the obesity rate that's driving the diabetes rate. In the United States right now, about 2/3, 66% of all adults over age 20 are overweight or obese. You need to remember that, MTA workers, because your numbers are even worse. When we talk about why this is occurring, it's pretty simple. 40% of us are sedentary. All of our jobs are sitting down, we're not exercising, and the worst part of it, we're starting to overeat. What is driving high blood pressure also is the obesity and this diabetes rate that's occurring. It's a concern not to you just for your personal health, but the biggest concern right now in the country is that this is only the tip of the iceberg. When we're seeing the diabetes rate and the obesity rate, what we're seeing is that in the future, we're going to see many, many more diabetics at a much quicker rate. And the worst part is that your children are starting to show signs of diabetes much, much earlier than we had ever expected. And the reason, again, is that obesity rate. Children are getting heavier at a younger age, and that's going to drive the diabetes at a much younger age and thereby cause all the problems that we're about to discuss. So what are the areas that we as Kaiser or as a nation are starting to focus on prevention of these chronic illnesses? Well, the first thing that we've got to do, clearly, like I said, is this obesity epidemic. Weight management is critical. I don't have a solution right now. I think together, medical groups, society, government, media, all have to work together to figure out how to do this, because right now, without weight management, we really have no ultimate solution. The other part of it is cholesterol management, blood pressure management, and obviously to not let people smoke. But I want you to understand that cholesterol and blood pressure are driven by that first problem I told you, the weight management. So one of the things that we've done for the MTA workers is we started to assess we call our biometric report at Kaiser. And what it is not waiting for the MTA drivers and their families to get sick or to be diagnosed with diabetes. What we've done is we have taken every visit that they've come to Kaiser, whether you come for an ankle sprain, whether you come for a headache, whether you come for a cold, we're measuring your weight, your height, we're measuring your cholesterol, we're measuring your blood pressure. We're also asking you at every visit whether you smoke or not. We then take that data and are able to make an assessment on you as a total group, MTA workers, MTA drivers, and your children, and we've now come up with some what we call biometric reports, and they are very alarming. I do a lot of these reports for a lot of major companies that Kaiser Permanente takes care of, but I will tell you I am very concerned about the MTA drivers and their families. Here is my concern. If we look at the reports that we're seeing, the obesity rates for MTA workers, they are much higher than what we would expect for our regular population. In some of the numbers, you're already hovering way, way above the 60% average that we're seeing in the United States. And in some areas, you're already hovering at about 80% obese and overweight, which means that if you are not diabetic right now or you don't have hypertension right now, you will. Okay, we can tell you that you will with certainty. The other problem is that your children appear to be moving also at a much faster rate than the average child in the United States. So between the MTA workers and their children and their families, we are measuring very, very high obesity rates. So what do we know about trying to manage this? People that are overweight and obese are going to cost 25% more in taking care of them in terms of healthcare costs. And 78% if you're just massively obese compared to a regular normal patient. So the costs are tremendous. So this is going to cause more premiums, it's going to cause more morbidity, more problems for all of your workers, and obviously the bottom line, it's going to be very expensive to take care of them as they increase their weight because they're going to generate more diabetes, hypertension, cancer, asthma, all of these things become worsened. So what are we asking people to do? Well, obviously the solution isn't just on our side as physicians. People are going to first of all understand how serious the issue is, and it is serious. We have many tools that we have online to try to teach people, first of all, to become very knowledgeable about what the body mass index is, the BMI. That should be a standard metric that we take at all times so that we could tell you what risk you're at. Most doctors are trying to have this conversation with you at every visit. The body mass index is really a formula. It's a measurement of your height, your weight. It's plugged into a formula which is readily available online. At every visit with your doctor, you could ask for your BMI. And what it does is it gives us an indicator based on evidence of whether you're at risk for problems, medical problems. We've determined that anybody under 25 is normal, has no serious medical risks, and that people from 25 to 30 are at high risk for future medical problems, and that after 30, there are serious risks for medical problems, and we call that obesity at 30. But overweight starts at 25. So this is an important measurement that you must become familiar with. And then again, you can find this online calculator probably any place in the web, but again at Kaiser, if you go on our website or at any visit, we can give you your body mass index. So what are you going to do for your children? Well, obviously you have to bring them in, keep measuring them. And when we talk about what we're going to be able to do to solve the problem, you need to understand that it's not going to be just changing your child's diet. That won't work. You're going to have to change the diet in the house. One of the things that I try to tell people is that you have a major food industry right now who is bent on making as much money in addicting you eating things that you don't need to eat. I could have a whole discussion on this, but the bottom line is when you like eating a lot of potato chips, it wasn't your fault. They were designed that way. They were designed to make sure you keep eating them. High fat content, high sodium, high sugar content are all part of the food industry to make sure that you keep buying these foods. Every restaurant overfeeds you. The prices are kept low so that you keep coming. The problem is the BMI will keep rising and all of the issues that we're talking about will come to fruition. It's really fascinating. Around 1960 is when this starts happening and some sentinel events take place. We don't want to blame one company, but it was really when Swanson invented the frozen TV dinner, things started to change. They created a product that had high sodium, it was easy to manufacture, it was easy to put on the table. The stuff is easy to chew, which is another issue. Things that are very easy to chew allow you to eat more of them quicker. And so what we had is now people being able to get cheap food when they want it, very conveniently, and lots of it. The word TV dinner is a scary thought too. Now you're eating in front of a television. And so the idea that you're going to be out there playing with kids or interacting in the community, now you're in front of a TV, eating a TV dinner that's convenient, And a lot of us think that that's kind of where the obesity epidemic starts to move way out of control. We were designed over hundreds of thousands of years to do one thing. When the sun came up, we started running either to get food or avoid becoming food. That's really how we're designed. What we've done now is we get up, we stay sedentary, and we eat all day. I mean, we eat at breakfast, we eat between breakfast and lunch, then we eat at lunch, then we take a break, then we eat again, then we eat right before we go to sleep. That is totally abnormal. Right now, what we're recommending is at least 30 minutes a day of vigorous exercise, your heart rate at about 80% of its maximum rate. And this is a discussion you need to have with your physician so that you know if you're exercising properly or not.